to attend these august proceedings and even speak to you. There. Does it work? Forward. These are my disclosures. It's humbling to give an address named after a giant of cancer surgery, Dr. Letton. Dr. Letton was the president of the American Cancer Society, which he volunteered for a total of 50 years. This particular ACS, with apologies to Dr. Turner, who will be here later today, was awarded me my first major grant as a faculty member and really started my way in academic surgery. I'm eternally grateful for that and all other philanthropic support. Dr. Letton advocated for education, research, and community empowerment. He was instrumental in getting the Pap smear accepted by women and their physicians back in the 1950s. I'm particularly grateful to Dr. Richmond, Bradford Professor and Chair of the West Virginia University's Department of Surgery, my friend and colleague from the ABS Council, for his presidential invite to meet you, my surgical siblings here in this beautiful town of Savannah, Georgia, and to Dr. Stewart and the entire program committee as well. For this lecture, the title of Dr. Richmond's talk, which I look forward to at 10:05, Finding Your Own Unique Place in the House of Surgery, inspired me. I will share some details of how I struggled to find my place in cancer surgery and how who I am, the choices available to me, and the roads taken and not taken by others and me influence the wonderful career I'm now blessed to enjoy. What I share is my own story and my own views, and I ask forgiveness for any boredom, discomfort, or as my kids say, cringe that my anecdotes may engender. My maternal grandparents, pictured here on their wedding day in mainland China, were a strong influence on their children and on me. My great-great-grandfather was the Chinese equivalent of an old-time country doc. He would wade through rice paddies to treat patients, and he'd take poultry or whatever his patients had or didn't have in trade. By the time my grandfather came around, he was a surgical resident at a university hospital in Manchuria, China, when he met my grandmother, who is a medical student. They married and had 4 children, but despite many of her peers not doing the same, she continued her medical school, graduated from her OBGYN residency, and went into practice as a OBGYN and a family practice doctor. Excuse me. After the Chinese Civil War and the communist victory, due to my grandmother's foresight, my mom's parents fled with their 4 children to Taiwan in 1949. Of note, they were criticized by many because they got 4 plane tickets at first. And people said, just take your sons, leave your daughters behind. And my grandmother refused to go until she could get 6 tickets and take all 4 of her children. Meanwhile, in southern China, my paternal grandparents did the same, except they left their daughter behind in Hainan and brought only their 2 sons through Macau to Hong Kong, some arduous journey back to Taiwan. And this fact haunted my paternal grandmother till her dying day, that she left her daughter behind. In Taiwan, my maternal grandfather was a general surgeon, and then after coming to the US and doing training in early thoracic surgery at City of Hope, a thoracic surgeon, the National Taiwan University Hospital and the Veterans Hospital, military hospital there. My grandmother, meanwhile, ran a clinic and an ambulatory surgical center adjacent to their house, and my grandfather would perform surgery at nights and weekends in their private practice with her assistants. My mother, at a young age, was dispensed to deliver prescriptions and messages throughout Taipei, and she's the 3rd child here. I don't know how they got 4 kids to stand like that. At the women's breakfast this morning, they were discussing how to stand, and it was like herding cats. So I have no idea how my grandmother managed that. My parents, who didn't know each other in Taiwan, attended university there, but longed when they were growing up for the greater opportunities of the United States. Initially, they were prohibited by the Chinese Exclusion Act of 1882 and its multiple revisions and extensions, culminating in the US system in the 1900s, in the mid-1900s, that limited immigrants to less than 2% at most from any country based on the 1890 census. This national origin system was finally put to rest in the mid-1960s, opening the way for ambitious immigrants like my parents to pursue their American dreams. After visiting my grandparents in Ethiopia, where they were by then working for the World Health Organization at a hospital there, my mom went to Kansas State to pursue chemistry because they offered her a scholarship. My dad went to the University of Colorado to receive a master's in aeronautical engineering. And my mom really, really wanted to go to med school. But as a foreigner, she was unable to get loans or grants to cover med school. And so she went and got a PhD in nutrition at UC Berkeley. where she met my dad, who was getting a PhD in mechanical engineering. After they wed, I arrived 2 years later as the best graduation present ever. So I've wanted to be a doctor ever since I can remember. Honestly, the only thing I've wanted more was to be a mother. I was never somebody who had pictures of my wedding day, but I always wanted to be a mom, and I wanted to be a doctor. I went to kind of okay public schools in San Jose and somehow made it through Stanford with degrees in bio and English, as you heard. But my desire to cut out cancer dates from medical school in San Francisco. In my preclinical years, I took a fascinating seminar on the molecular biology of cancer with giants. It was one-on-one with Harold Varmus and Mike Bishop and Bruce Alberts. It was incredible. But at the same time, my beloved grandparents who had moved to the United States and retrained in medicine and practiced for decades were going through a crisis. My grandfather was diagnosed with bilateral adenocarcinomas in both lungs. I was struck by both the unwillingness of their 4 incredibly educated children to discuss the true nature of his diagnosis, to even discuss hospice, end-of-life care at the time. And yet, as he was dying, he was so focused on his grandchildren, what we were going to be and how we were going to be happy. And his very last intelligible words to me were, "You should be a subspecialist. You are not going to be happy in primary care." I had made the mistake in my idealistic way of telling him I was going to do primary care, women's health, or maybe OBGYN. And you know what? He was right. So much to my shock, as a third year student, I fell in love with surgery. I did transplant with Asher and Roberts, and gold surgery with Ted Schrock and TK Hunt, and Marco Patti was the chief president on trauma with Bill Schechter and giants of trauma surgery. You know, resistance was futile. I went with Sean Mulvihill, who's now in Utah as a 4th-year sub-I, to break the news for a wonderful patient pathologist who had a diagnostic laparoscopy and then an aborted Whipple. And there was nothing we could do. And I was furious, like there must be something we can do. My closest female friends, meanwhile, in medical school, all loved surgery, got honors in it. And I full disclosure, I just missed honors. But they didn't want to go into surgery because they said, "I want to have a family." Well, I've always been stubborn, but I remember having an argument with my mother, who went directly from "you are not allowed to date" to "where are my grandchildren?" My mom, she said, "Why don't you go into pediatrics or ophthalmology?" And I said, "What do these things have in common?" And anyway, she wanted me to do something quote unquote easier. In the end, she tried stuff like, "I watched you very closely as a kid. You're not that good with your hands. Your piano teacher said so." And she also laid the guilt on. And she said, "Why do you always have to do the hardest thing?" So I ended up at Mass General for residency, as Dr. Richmond told you. And I think they took me because I nervously mentioned during my group interview, where they, kind of 20 people ask you questions, that my grandfather performed the first closed mitral commissurotomy in Taiwan. And Dr. Gordon Scannell, who I did not know, but now I know is a giant of cardiothoracic surgery, performed the first one at MGH. And I think that lone fact alone caused them to rank me to match. I dislike the term imposter syndrome, but I was definitely a fish out of water when I got there. My fellow interns were superb, and to me, intimidating, including one born at the MGH and essentially raised at Harvard, and another one whose ancestor co-founded the hospital. My only flat shoes I had were Birkenstocks. I didn't own a winter coat. I had never heard of the AFC, essentially, and who were these so-called patriots anyway? And I didn't understand why anybody would need 2 stadiums, a football and a baseball. One candlestick is enough. Well, I'll confess, I did go east in part for a guy. And I will say there is fault on both sides, but it took him a while to get around to proposing. There were some obstacles. We were from opposite backgrounds and coasts. We were registered in different political parties, had divergent views on privacy and whether or not someone should hire house cleaners. I was pro, for the record. He's been Roman Catholic since birth. And while my mother was baptized by missionaries in Taiwan, she and my dad thought that my brother and I should decide for ourselves, like they did. So he was also indifferent to football, either college or professional. And he dislikes outdoor activities unless there involves a beach or pool with a fruity drink with an umbrella in it. And he has no idea what March Madness was. Worst of all, the man roots for the New York Yankees. So as we know in cancer surgery, with enough effort and neoadjuvant pretreatment, miracles do happen. I conceded that I would seek a job in Massachusetts. He agreed to house cleaners, skiing vacations, and Asian in-laws with an occasional residency. I spent 6 months in intensive study with a Jesuit priest, and then was baptized Catholic on Pope John Paul II's 80th birthday. Here we are with his intrusive Asian in-laws, and some of my co-interns and their spouses on our wedding day, which is Labor Day weekend in the year 2000. By this time, I was my third year of research with Richard Mulligan, Judah Folkman, and others working on pancreatic cancer vaccines. I decided in a career of surgical oncology, preferably of the upper gastrointestinal variety, with clinical research and teaching ambitions. I was also eager at the age of 31 to get on with my lifelong ambition of being a mother. I proposed to my new spouse on our honeymoon that we embark on this journey immediately. My husband has a kind of a faux bro New York sense of humor and said, well, I'm Italian, so of course I'll get you pregnant immediately on the honeymoon, but when are you going back to residency? And I said, well, it's Labor Day weekend, July 1. And his jaw dropped and he laid down the law. He would not be the primary caregiver for an infant, for this proposed infant, while I returned as a PGY4 to residency. He said he would have to call DSS on himself. So we delayed. When it became time for me to apply for a fellowship in complex general surgical oncology to fulfill my lifelong dream of being a cancer surgeon, my conflict between my chosen career as a cancer surgeon and my family aspirations reached crisis mode. I only applied to 3 programs. My reasoning was if I was going to leave my immovable spouse for 2 years, it would need to be for an extremely good reason. Now, remember, this is in 2002. I would make a very different choice today because the diversity of programs now in surgical oncology is extreme, and there are so many great programs all over the country, including now Boston. But I would make a different choice today. But that's what I did. I was incredibly fortunate to match at UTMD Anderson in Houston, where I have family. My closest cousin lives there, and I could fulfill my secret ambitions to work with Doug Evans, Peter Pisters, Jeff Lee, and others. I started fellowship in Houston in 2003 at the age of 34 3/4, but who's counting? My husband and I agreed we would fly back and forth every other weekend to see each other. It's actually wonderful for 2 people that have busy jobs and no kids yet to work as hard as you can all week long and then see each other on the weekends. For the first time, we actually had dates. It was great. I gloried with helping breast, melanoma, sarcoma, colorectal, hepatopancreatic biliary cases, and helping patients live their lives. So 6 months before fellowship ended, I allowed the idea of not trying to not get pregnant, and lo and behold, my husband was right. A fetus with the estimated date of confinement of mid-November 2005 occurred. So this is the part where the squeamish should hold their ears, but we're all doctors here, right? I concealed my pregnancy from everyone except my program director and my husband, but for the entire pregnancy. Again, I'd make a different choice today, but the year before, this is why I did this. The year before, a female fellow, complex general surgical oncology fellow, was pregnant, and she had preterm labor, and she required bed rest. And I heard a fair amount of complaining from some male fellows, all who were fathers themselves, about covering for her. I resolved not to make my pregnancy an item of discussion unless it needed to be. It never was. I never missed a day of work during fellowship because of my pregnancy. I planned my first OB visit at 10 weeks gestation to coincide with my 1 week of vacation to be spent in Boston. On the way to George Bush International Airport, I had an event in the car. Upon making it through security at Bush, I was certain I had miscarried. But after calling my spouse and him using his privilege to page my scheduled OB who hadn't met me yet, it was at the same hospital. I somehow blundered my way onto the plane and into Boston. I didn't want to be alone. I had an urgent ultrasound at the Brigham where the MD came out and gravely told me that our long-desired fetus, while alive, was implanted so close to the cervix that in conjunction with a previously unknown 14-centimeter fibroid, this was functionally a cervical, aka a type of ectopic pregnancy that would not come to term, would be life-threatening to me, and would need to be terminated. This was devastating news. My husband was terrified for my health and was ready to proceed immediately with a recommendation. He tried to comfort me with his faux bro humor because, he said, I worked very hard to select the best mother for my children, and I need her to be alive to allow my genes to continue in the world. I did not find this funny at the time. At my request, he also used his privilege to get me a next day private practice appointment with Dr. Beryl Benassaraf, who is the founder of genetic ultrasound imaging, and who happened to be married to my husband's boss, Peter Libby. So this is extreme privilege. Beryl repeated the imaging herself and told us that while there was certainly a heightened risk for fetal demise and maternal complications, including need for emergent hysterectomy, massive bleeding, possibly fatal, there was some chance of viability. And with careful monitoring, we could decide to make the calculated choice of wait and see. With considerable anxiety on the part of my husband and less on mine, because surgeons are optimists, right? I went back to Houston and I finished my training in advanced surgical oncology. My cousin Charlotte, who worked in Gyn-Onc at MD Anderson, found a lovely Southern gentleman with a bow tie, who was a high-risk OB surgeon at St. Luke's, who let me run madly across the Texas Medical Center, unscheduled every Friday between cases, to have an ultrasound to make sure that the fetus was okay and I was okay. This picture is our bar graduation with my fellow complex general surgical oncology fellows in the front row, from left to right: Tom Aloya, John Mullen, Keith Delman, Todd Bauer, and Tim Pollock. The two other women in the front row were the breast fellows, Nazneen and Roshni. No one knew of my pregnancy then, except for the guy in the hat, Steve Curley, who was my program director at the time. Although Keith's wife, Dana Maney Delman, is actually an OBGYN, and she guessed at that graduation dinner. I can say with 100% certainty that if the current Texas laws were in place, my husband would have never let me get back on the plane to finish my fellowship, and my career would look very different. During all this, I was scheming to get a job at Boston Medical Center and Boston University. This is a picture of the old Boston City Hospital. Rebecca Britt told me it was called Cité back in the day, but at that point I was oblivious to so I call it Boston City Hospital. My time in Texas had made it very clear to me that I wanted a career in upper GI surgical oncology with long and difficult cases. While I had a longstanding interest in basic science and tumor immunology, at MD Anderson, for the first time, I was privileged to take care of a diverse patient population and witness and investigate disparities in care. I hope that Dr. Letton would be proud of my first paper from MD Anderson. As you know, he was an expert in breast surgery, among others. We elucidated different rates of immediate reconstruction of breast cancer based on race, which helped MD Anderson develop protocols to make sure all patients were offered appropriate options for care. At BU and BMC, which is my desired first job, they had a position. Doug Evans was my mentor. He was a medical student there. He came and gave the Mausam visiting professor, told him to hire me. They said they would hire me. I interviewed multiple times, including in my office today. And they told me they were going to offer me a job, and then they ghosted me. They ghosted me. They did not offer me a job. They went a different direction. But luckily, I had the good fortune to get a job at UMass in Worcester. And while I had zero startup package and it required an hour-long drive each way, we had a great community, great bosses, great residents, and the whole community. And so I was able to establish a pancreas cancer program and SOAR, which you heard about. It led me to getting that independent funding from the American Cancer Society that I discussed. And more importantly, I was able there to achieve my lifelong dream of being a mother. So in 2006, that first fetus, now born, and I did the UMass Walk for Cancer. This is, I have a great picture of this, but it's all of us coming together wearing these purple shirts. I designed the shirts. I did this little like hope myself and with a little thing. And it was doctors and nurses and secretaries and friends and researchers all coming together and for walking for patients with cancer, raising money for the cancer center. And then after we got home, this my son was sitting there, and this is not a political statement. These are his balls, and he's about to like throw a ball at me. He's trying to decide which one do I throw at my mom. That's my foot there. Do I throw the red one or the blue one, or I throw both of them, or whatnot? But to me, it represents all the choices that we make and that we make in cancer surgery in our lives along the way. Finally, more than a decade after trying and failing to get hired as a new fellowship grad by BU and BMC, I was lucky enough to be appointed Utley Professor and Chair at BU and Surgeon in Chief at BMC. We focus on health equity from research, educational, and clinical aspects. And we have a BMC Health Equity Accelerator, which aims to provide exceptional care without exception and promulgate best practices wherever they're needed. As you know now, I'm not a native New Englander, but in my decades on the East Coast, I've learned something about history. And the words of John Winthrop, who was a preacher and a colony leader, resonate to me. They've been used by politicians from Kennedy to Reagan and beyond, but to me, these words represent healthcare, or can be used by me, at least represent healthcare. And he said, "We shall be as a city on a hill. The eyes of the world are upon us." We're all faced with difficult choices, even in positions as privileged as I've generally found myself. The journey toward a lifetime career in cancer care is no exception. And I, for one, feel that we should enable those around us to make their own choices as best they can, whether they're patients or trainees or colleagues. Went the wrong way. So lastly, well, why do we do what we do? So this is Sean and Liz used with express permission and signed consent, a dear patient that I have known for 2 decades who had pancreatic cancer. And he had an aborted operation at a famous hospital in Boston, not mine, and was told he was incurable and had a double bypass. And then he was told to get some palliative chemotherapy and to get his affairs in order. He sought an opinion from my mentor, Doug Evans, at MD Anderson. And on Doug's advice, he had neoadjuvant chemo, radiotherapy in Massachusetts, and returned to Houston for his reoperative pancreatic duodenectomy with a vascular reconstruction while I was a trainee. This photo is from 2020, and I follow him now at Boston Medical Center. And last year, Sean walked his daughter down the aisle as a 20-year survivor of pancreatic cancer. So kid one, my first fetus, his former first fetus, is 17 now. He takes after his father in most ways, but I'm pleased to report he hates the Yankees and he loves football. After one of his heroes, Devin McCourty on the right, or I guess on the left, it's anatomic right, asked him if he were going to be a surgeon like his mom. My son said, "Well, yeah, maybe I might." I consider that a mom win. I'm grateful for my career as a cancer surgeon and to the choices I have had and been allowed to make along the way. I'm really grateful to President Richmond for the kind invitation, to the Southeastern Surgical Congress for the privilege of the floor, and for your generosity in hearing me out. Thank you. Oh, wow.
So on behalf of the Southeastern Surgical Congress, I would like to present Dr. Singh with this commemorative crystal for her wonderful lecture and thank her for delivering such a wonderful presentation to our body. I have one other order of business. We're a little bit ahead of schedule. We can move directly to the plenary session, but I did want to do one thing when I allowed the room to get a little more full as people were coming in when we were doing the original announcements. I'd like to ask all the past presidents and Distinguished Service Award winners to please stand and be recognized. So, you know, the collegial nature of the organization, you know, I think is what defines the Southeastern. And you know, the nice thing about the Southeastern is we have a culture that is so inviting to young trainees, and the people you just observed standing are the thought leaders in American surgery. And at this meeting, you will feel comfortable approaching them, and maybe you wouldn't feel that way at other meetings. And I think that's what defines the culture of our organization and makes us so effective. So with that, let's take about a 5-minute break, and then we'll get together and start a little early on the plenary session. So we'll reconvene in about 5 minutes. Thank you.